I was speaking on mute for a long time. Sorry, everyone. Good evening, welcome, and thank you all for joining this informational event on the COVID-19 vaccine. This event was brought to you by the city's Department of Health and the Vaccine Command Center in partnership with St. Nick's Alliance, Assemblymember Gallagher's office, and our neighbors at Greenline, Los Sures, Brooklyn Community Board 1, Conselyea Street Block Association, the People's Firehouse, Lindsay Park North, Cooper Park, and Williamsburg Houses Residence Councils. I'm Danielle Zuckerman. I work at the Vaccine Command Center. I also work at the Department of Transportation, and I'm coming to you live from my apartment in Greenpoint. And we are joined by a couple of folks from St. Nick's Alliance who are helping out with our interpretation lines. And we're joined by Dr. Watkins today, who will talk through the latest on the vaccine, its safety and efficacy, and how to access it in New York City. We know it's been a very challenging time for everyone, and there's still work to do to keep us safe from COVID-19 and enable our communities to recover. The COVID-19 vaccine is a critical step on that path, and we're thrilled to be able to bring you all of the information you need in order to make an informed decision about the safe, free, and easy vaccine. So today, Dr. Watkins is going to give a presentation, and then we'll open it up to questions from participants. If you'd like to ask a question, you can enter it into the chat box. If you're dialing in over the phone, if you want to unmute yourself to ask a question, you can press *6. And if you need interpretation, there's a line for that. I'll turn it over to Fatima to give the Spanish line.
Ok, buenas noches. Para el español, si usted necesita una traducción en español, puede hablar al 866-213-863, 866-213-863, y después el código de la identificación es 8893087, 8893087. Con eso pueden llegar a la interpretación en español. Si necesitan abrir su micrófono, aprieten la estrella 6. Gracias.
Thank you, Isaac. And for Polish. Annette, do you want to read it out? I think you're on mute.
Jeśli potrzebują Państwo polskiego tłumacza, proszę wybrać numer 6144415.
Thank you. So I hope you guys enjoy, and I'll turn it over to Dr. Watkins.
Hello, good afternoon, everyone. I hope everyone can hear me okay. My name is Dr. Julian Watkins. I'm an internal medicine trained doctor at the New York City Department of Health and Mental Hygiene. I normally work in the Bureau of STI Control, Sexually Transmitted Infection Control, mostly working with folks to test and treat for sexually transmitted infections and HIV. So that's a lot of the background that I bring to the work of this pandemic. I'm happy to be here, grateful for the St. Nick Foundation and for the Assemblymember for inviting us. I hope that we can answer any questions that folks may have. I'll try to leave a lot of space in the end if folks have questions. And bear with me for 1 second. I will share my screen. All right. Can you see that okay?
Yep.
Yes.
Right. So again, welcome to the presentation. We'll give an introduction into the vaccines. But to start, we'd like to give a little bit of a situational awareness so folks can understand where we are right now. All right. So to start, New York City has seen a lot of COVID cases across the city. Over 100,000 folks have been hospitalized because of COVID-19 in the city, and over 33,000 New Yorkers have actually died. New York City has lost more people than actually some states in the United States. And I know a lot of folks probably remember some of those really dark days of March 2020, but also that second wave that happened towards the end of 2020 as well. Do want to acknowledge that some neighborhoods have been hit harder than others. Folks who identify as Black and Latino have experienced the highest rates of illness, hospitalization, and death. And the disproportionate impact of this pandemic on particular communities, especially in Brooklyn and parts of the Bronx, and Queens, really just highlight the results of a lot of historic and ongoing structural issues, racism and marginalization within our city. So I wanted to kind of give a little bit of background about what's going on currently in Brooklyn, since this is a Brooklyn-based talk. So if you look to the very top left of the screen, you can see that little box. You can see to the right, you can see the citywide percent positivity. So out of every 100 people who are testing positive in New York City, literally a little bit over one out of every 100 are testing positive, closely approaching 2%. Brooklyn is a bit higher than the citywide average. If you look to the right of the screen, you can see what we call a heat map of the 5 boroughs. Brooklyn is circled in blue. The deeper red colors show where case counts are a bit higher. So that's where the percentage of positivity is higher. So you can see it's not evenly distributed across the borough of Brooklyn. You can see some places are deeper red. Some of those percent positivities are a bit higher than this 1.45 average. But at the New York City Department of Health website, you can actually go to the website and click on your zip code and see what's going on in your zip code in terms of cases and in terms of vaccination. The image to the bottom, at the bottom left, is just showing where we've been over the last year plus. And all of this information is available online. So now we'll just talk about vaccinations. Starting looking to the left of the screen, we'll talk about vaccinations in the United States. There's been over 330 million vaccine doses administered in the United States. That is a major effort. Over 159, nearly 160 million folks have been fully vaccinated in the United States. That's nearly 50% of the population. Looking to the right of the screen, we can look at New York City, and we can actually see that we're approaching 10 million vaccine doses administered. That is a major Herculean effort, not just the health department, but a lot of folks in communities advocating to get that many doses into arms. At the bottom right of the screen, you can see that over 4.4 million New Yorkers have been fully vaccinated, and we continue to vaccinate folks all over the city every day. So talking about COVID vaccines in New York City, about 57% of all New Yorkers have gotten at least one dose of the vaccine. When we look at folks who are adults, that's nearly 70%. So that's people who are 18 and older. We still have a long way to go, basically. So if you look to the right of the screen, you can see another kind of this heat map. We can see the deeper blue represents higher percent of folks being fully vaccinated. You can see across Brooklyn that there's a lot of places that don't have a lot of folks who are fully vaccinated. Some areas which are in the 30% of the population vaccinated. So we still have a long way to go, especially in communities that identify as Black or Latino. So that's why we're going to hear just to talk about the vaccine, answer some questions, and then keep this hard work going. Oops. I'm looking at Brooklyn. You can see just some of Brooklyn vaccine data. You can look at to the top right of the screen. You can see that overall for residents, these are all residents. 58% of folks have gotten at least the first dose. 53% of all New Yorkers have been fully vaccinated. In Brooklyn, it's a little bit lower than the average, the citywide average. And if you kind of look, you can kind of see where the concentration of folks who are vaccinated are. So there's still a lot of work to do across Brooklyn. So we'll talk a little bit about the vaccine development and authorization. Folks may have heard some of this before, but we'll kind of go through it. And please let me know. You can unmute if you want me to slow down. So a lot of folks ask the question, how were the vaccines developed so quickly? Basically, vaccines have been around for over 200 years. So scientists are always looking at new ways to vaccinate us and new and more efficient ways, safer ways. So basically, when the pandemic happened, a lot of scientists around the world were building on a lot of the research to make a new vaccine. And we broke records because a lot of the federal government put a lot of money and a lot of person power into testing and producing these vaccines all at the same time. So some of these bigger pharmaceutical companies, they had the resources and they had the infrastructure to actually get vaccines started and distributed. And so this big effort was not just the federal government, but state and local health departments and healthcare providers. And a lot of folks were working for months to really figure out how to store the vaccine, distribute the vaccine, and build out networks for vaccination. Oops. So as folks may or may not know, in New York City, in the United States, there are 3 vaccines that are available. I won't go through this whole chart, but basically thousands of folks were in the clinical trials. They had, you can see to the right of the screen, you can see that the representation for race and ethnicity was really good. You can see for folks 65 and older was also really good. Folks who were living with underlying medical conditions had a lot of representation. And now these over 133 million vaccinations in the United States, those are all either of these 3 vaccines. So a lot of folks have been vaccinated with these 3 vaccines, and overwhelmingly they're safe and well tolerated and effective. Want to talk a little bit about the authorization process. So as folks may know or have heard that the U.S. Food and Drug Administration, part of their duties are to regulate and to review clinical trials and protocols for medications. So they've been really involved with this process for authorizing these newer vaccines. Also, the CDC is involved. These clinical trials were closely monitored, checking for safety by groups inside the government, but also folks outside the government. A lot of clinicians were involved, people who are looking in ethics of testing, people who are looking at stats, a lot of patient advocates wanting to, monitoring the process the whole time. So that's been really encouraging, and that's kind of how we got here today. There's continued safety monitoring of the vaccines. As folks may have heard or seen in the news recently, the VAER system, the Vaccine Adverse Reporting System, this is a system that's always been in place. As a healthcare provider and someone who routinely vaccinates people even before the pandemic, we're all trained on how to report adverse events or unexpected events that happen around vaccines or after vaccination. So using this tool, that's how we monitor what things are happening with folks who've been vaccinated. That's how we found out about the possible risk for blood clots earlier this year. That's how we found out about these rare instances of what we call Guillain-Barré syndrome, which is a few folks out of these millions of people have reported some neurological symptoms. So this is kind of like our safety monitoring system, and all of the alerts are reported. Folks can actually check these and check the alerts, and I think it just basically demonstrates the safety mechanisms that we have in place even after vaccines have been approved for use. So we'll talk about how vaccines work. As folks may know, Moderna and Pfizer use what we call mRNA technologies. These are newer types of vaccine technologies that have been studied for over 30 years using mRNA, which is a genetic material and a basic building block of life that our bodies use our own mRNA. They basically were able to modify, make mRNA that looked like coronavirus to help our bodies produce a protein that's similar to one found on the coronavirus that helps our bodies induce immunity. The Johnson & Johnson Janssen vaccine uses a little bit of a different mechanism using what we call adenovirus vector. Basically, they use a modified viral particle, take out its genetics, make so that it can't make you sick, make so that it can't multiply. They use that as a carrier for the genetic material to help our bodies produce the immune response that we want. These vaccines do not contain the virus that causes COVID-19. They cannot cause COVID-19 infection. They cannot change your DNA. They cannot turn you into a lizard. They are not activated by 5G. Just wanted to put that out there. I kind of talked through some of how things work, but basically, once you get vaccinated, the vaccines contain some genetic material that our bodies using our own mechanisms, our own our own machine, our own internal machinery. We actually can make this protein, and that protein is what is really helpful for our bodies to recognize COVID-19 if we come in contact with the virus in real life. When I talk about vaccines, thinking about the vaccines actually help our bodies build like the emblem of a car. So we know a Ford when we see a Ford just by looking at the emblem, and it's the same thing for COVID-19. Our bodies recognize the emblem, not the whole Cadillac, but you can recognize it and know how to neutralize and defend ourselves from this deadly virus after you get vaccinated. Vaccine ingredients are available. You can see the full list of ingredients on the FDA's website, but it's really important to understand that the vaccines do not contain any antibiotics, no blood products. They do not contain fetal tissues or cells. They don't contain gelatin or any other pork or animal products. Nor do they contain gluten, mercury, microchips, or the virus that causes COVID-19. If folks want the list of ingredients, you can find it at the FDA website, and that's something that can be at any of the vaccine sites. They can actually print that out for you. We know that vaccines are working really well. They've been shown to be overwhelmingly safe and effective across people of all gender identities, ages from 12 and up, race and ethnic groups. There's a lot of studies underway for people younger than 12. And basically, the vaccines have been really effective at preventing severe disease, illness, hospitalization, and death. There was a new study that was recently released just today. I don't know if folks heard the mayor's press conference or heard the commissioner talking about this study, but basically it's just shown that overwhelmingly in New York City, the people who are getting sick with COVID-19, who are being hospitalized for COVID-19 and who are dying for COVID-19, over 98% of those folks are people who are unvaccinated. So it's really good at preventing infection, preventing folks if the rare chance they do get ill, preventing severe illness, preventing hospitalization and death. That's really important, and with over 130 million people vaccinated in the United States, we have a lot of evidence and a lot of evidence supporting how safe and effective these vaccines really are. We still have a lot to learn about vaccines. Since this pandemic is just a little bit over a year old, and vaccines were just administered in December to the broader population. We'll learn more week by week, day by day. So we know that the vaccine protects and lasts at least 6 months, and is promising to last longer, even up to a year. So we're keeping our fingers crossed, and whenever we find more information, we'll let you know. Boosters. We don't know necessarily about boosters, but as folks may have heard in the news, other parts of the world are giving boosters, so we'll learn about that. But also in the United States, Pfizer and Moderna are doing studies around if we actually need boosters and how to make boosters that can protect us from some of the new variants that are out there. We also know that there's a lot of studies and evidence showing that the vaccines do protect us from these new variants. But this is something that the health department is monitoring, and we're investigating folks who've been fully vaccinated if they do test positive, just to kind of see what happened, and we're actually testing folks to check for variants and monitor for any new variants that may happen. Who can get vaccinated? The short answer is anyone who lives in New York who's 12 years and older. People who are 12 to 17 can only get the Pfizer vaccine, but we should see in a few, probably pretty soon, we'll see the Moderna vaccine actually be available for folks probably 12 and older. Vaccinations are free. Vaccines, even with insurance or not, you can get vaccinated. Regardless of your immigration status, you can get vaccinated. People, when they get vaccinated, their privacy is protected. You should not be asked to pay for vaccines. We will say that if you go to, one of the non-city clinic sites, if you're going to a provider, if you get other services, they may charge you, but you will not be charged for the COVID-19 vaccine or the needles or the Band-Aid. That's really important. That's something that the tax dollars have paid for. A question that we get commonly is, can people with underlying health conditions get vaccinated? The answer is overwhelmingly yes. People with medical conditions can get vaccinated, and it's actually recommended to get vaccinated. A lot of, as we saw a bit earlier, a lot of folks in these clinical trials have with underlying conditions. A lot of the common ones, and then some of the more rare ones were included in these trials. And also hundreds, with over 100 million folks vaccinated, a lot of folks in the United States have also been vaccinated with similar conditions that folks may have on the call. Question, can folks who are pregnant get vaccinated? Yes. Can folks with weak immune systems get vaccinated? Yes. The data is showing, we don't have tons of data because there's not that many people who are pregnant at the time or who are living with weak immune system, but overwhelmingly those folks have suffered disproportionately when they get sick with COVID. So it's actually recommended for folks in those groups to get vaccinated. If folks have any questions, we can talk on this call, but even, I definitely encourage folks, if you have a healthcare provider, to talk to them and to ask them about your specific medical questions and your medical needs. And also you can call 311 if you have any questions around vaccination. Should folks get vaccinated if they've had COVID-19? The answer is yes. We know that folks can be infected more than once. We're seeing it out there. And the vaccine is just a way to add levels of protection. Folks question, oh, I've had antibodies, I've had the test. We know that folks who are infected with COVID-19, that the antibodies can wear out for some reason. They don't last the protection from having the infection does not last nearly as long as vaccination. So it's definitely encouraged to get vaccinated and just really to consider anything that we can do to protect ourselves and our families from this deadly virus is a good option. For folks who recently tested positive, you don't have to wait 90 days anymore. That was a thing that folks have heard in the past. Basically, you just have to wait. If you recently test positive, just wait for your isolation period to end. You don't actually have to get tested before you get vaccinated for COVID-19. And we do not recommend checking antibody levels after the vaccination because there's a lot of different antibody tests, and some of those antibody tests don't really show, may not catch it, and we don't want to worry folks. Folks who are living with allergies should also get vaccinated. Folks who have the most common allergies like food allergies, pet allergies, dust allergies, antibiotic allergies, medication allergies, latex allergies can safely receive the vaccine and are safely receiving the vaccines. If folks are concerned, they can talk to their healthcare provider and they can review the ingredient list to check for any allergies on that list. And folks who've had severe reactions before or who have any reactions to the COVID-19 vaccine should talk with their medical provider. And we do monitor folks 15 to 30 minutes after they get the injection just to make sure that we can catch any reactions. So getting vaccinated, we'll kind of brush through this because we are kind of getting close to time, but we'll say basically we're really working on making the vaccine accessible to folks, and I think now more than ever, anyone can get vaccinated. We have the vaccine sites in communities that have been impacted. We have vaccine trucks, vaccine vans, we have vaccine tents that are available for folks. We're working with community-based organizations. We have vaccine in pharmacies. We actually have a home vaccine program. I'll share the number later. Where any New Yorker 12 years and older, if you're interested in getting vaccinated, you can actually call a number and get someone to come into your home and vaccinate you to remove as many barriers as we can. We're listening, and this is all because of a lot of community advocacy. Folks want the vaccine to want to bring vaccine to communities, and this is an effort to do that. So I think it's really encouraging to see that we can get vaccine out there. But we also know that some folks still have questions, and folks do have their concerns, and that's why we want to actually go out to community groups and have these conversations like we're having tonight. So the Vaccine Finder website that folks may have heard about is a good way that you can find a vaccine site. You can check by vaccine, you can check by location, you can check if they, you can actually still make appointments if you'd like. You can actually call the number 877-VAX4NYC to set up these appointments. You can get free transportation to or from a site if you don't want to actually use the home vaccine program. Many different ways to get vaccinated. Love to talk more about how you can get vaccinated in New York City. I think it's really important to talk about side effects because it is something that can happen, and I know it concerns a lot of folks. So in general, when we get vaccinated, sometimes we can actually have some side effects. That is actually a normal part of the process because as our bodies are activating, our immune systems are revving up and building up that immunity, building antibodies, getting our immune cells active. Sometimes we can actually feel some soreness, we can feel some headaches, body aches, tiredness, or fever. Luckily, those do not last for more than 2 to 3 days. Usually end about 2 days after. What else? They're actually less common in folks who are considered older, like 65 and up. And the most common thing is a sore arm from where you get the injection. Pfizer and Moderna vaccines, some folks do report having a bit more symptoms after the second shot, but overwhelmingly, I talked to hundreds of people about vaccines. I got vaccinated. Overwhelmingly, the folks say it's definitely worth it for that for that peace of mind, for safety and protection against the virus. Allergic reactions are extremely rare. The most concerning allergic reaction is what we call anaphylaxis. That is really, really rare, but that's why we monitor folks 15 to 30 minutes after injection, because if you would get it, that's when it could happen. But again, it's extremely rare. Everyone, as I said, everyone's observed, and if someone has a reaction at home, they can call 911, or if someone is concerned about something, they can call 311. If they want to talk to their medical professionals that the city is making available. Folks got vaccinated and aren't sure, is this a serious side effect or is this a side effect? So that's a service that is available as well. Talking about some other side effects and concerns for Johnson & Johnson, we heard about there was rare blood clots, and also we heard about this rare neurological condition called Guillain-Barré. These are the FDA has actually updated some of the warnings to make folks aware that it's a very rare occurrence. We want to just make sure that folks know that it has been found in a few cases around the country. And then I think the biggest other thing is really just like there's choice. We have choice. If folks don't want the one vaccine and done, they can get the other vaccines. But if folks do want to just do one vaccine and finish their course, talk to your medical provider and ask them, like, is it worth it? What should I do? And a medical provider can definitely sit down and help you make a decision together. So as we get ready to wrap up, what can we do when we're fully vaccinated? So, with new variants spreading and all of this stuff, definitely recommend wearing a face covering if you're indoors and you don't know the vaccine status of other people. You don't have to take off your mask, even though we'll see other folks with their mask off. It's definitely about your comfort. And when in doubt, you can just wear the mask. But definitely, follow face covering requirements in certain businesses and schools, public transportation. Just because some folks can't get vaccinated for some medical reasons, or and the pandemic is still out there. You don't need to get tested for COVID-19 if you're vaccinated as routinely. Only if you get tested for like work or screening, or if you have some symptoms, you should get tested. But in general, definitely getting vaccinated can help you give that peace of mind and protect you from the virus. I think one of the last things that we really should talk about, and I would feel wrong if we neglected to talk about, is that the pandemic has been stressful and that it has been traumatic for folks. And it's really important that folks really take care of themselves, take care of their loved ones and friends and folks around them, and just know that if you are feeling overwhelmed or stressed, that there are free mental health counselors in multiple languages that the city provides for folks. Folks can call 888 NYC Well. You can also text. To connect with someone. There's also emotional support hotlines available as well. So just really wanted to share those resources. And with that, we can take some questions.
Thank you so much, Dr. Watkins. Really useful and critical information in there. So we're going to do some Q&A. If you want to ask a question, you can enter it into the chat box. If you're dialing over the phone, you can unmute yourself by pressing *6 in order to ask your question. And I'm just going to let the interpreters remind everybody of the conference line. Aneta, do you want to give the Polish line? Oh, it looks like she's having some difficulty. Let's go to Isaac. Could you give us the French line?
Okay. Sí, buenas tardes. Si quieren, ahora van a hacer preguntas y respuestas. Si quieren, pueden ponerla en el chat o pueden hablar directamente al teléfono Ya habíamos dado antes. You have the phone, I'm sorry, I don't have the phone number in front of me.
Sure, let me just re-up it here.
866-213-18. Okay. Si están interesados, y también pueden abrir su micrófono aquí. Si quieren hacer una pregunta en español, la pueden abrir su micrófono aquí también y nosotros la vamos a traducir. Gracias.
Thanks so much, Isaac. And it looks like Aneta is having some technical difficulties on her end, but we will see if we can get her back. So let's just start. I have one announcement that Jose from St. Nick's Alliance wanted me to make, and that's that the vaccine site at 211 Ainsley Street at Swinging 60 Senior Center is open through the end of the month, and that's really the anchor vaccine site in the Williamsburg Greenpoint area, super close to the subway. And if you don't want to go over there, you can just hop on nyc.gov/vaccine finder, as Dr. Watkins mentioned, and you can find sites near you or near where you work or where you play. We have pop-up sites all across the city every day, so check that out. So let's get into a couple of questions here. This is a question from Jake. He says, "Hi, I'm a male in my 20s. Should I be concerned with the J&J nerve disease news? It's scary."
Hey Jake, I would say, it's still extremely rare. And I would say depending on, what your medical decisions are, if you still kind of want the one dose, I think the Johnson & Johnson vaccine is an overwhelmingly good vaccine. Recent studies show that it's protective against the Delta variant. So I think it's a good option. I think it's just something to keep in mind that it has happened to some folks, and if it's too scary and you'd rather not, I think the other vaccines are also really good options.
Thanks, Dr. Watkins, and thank you, Jake. Another question here. Do you have any special advice for people who might be on the fence?
Yeah, I would say, if you're on the fence, I would say as long as you keep an open heart and open mind, talk to folks who've been vaccinated, find some good resources, listen to some there's a lot of conversations that folks are having about vaccines, but I say overwhelmingly just keep an open heart and mind when you're thinking about vaccination, because for me, as a public health worker, as a physician, just knowing how vaccines can and have saved humanity. We have the potential to really end this thing, to keep us safe. That's kind of why I got vaccinated, and it took a lot of time to convince some of my own family members and people in my networks. Just because, again, we see across the country, numbers are going up. Across the city, we're seeing cases going up. In other parts of the world, we see people are dying. So I think it's a really important thing to consider, and find the right vaccine for you, one that makes you feel confident. Yeah.
Thanks, Dr. Watkins. And I know you mentioned earlier the announcement the mayor made today about, how many cases of COVID-19 and deaths that have been prevented. Actually, I'm trying to pull up those stats, but in the meantime, let's take another one of these questions. So you talked a lot about, people who, most people can get the vaccine if they have underlying health conditions or allergies. Is there anyone who just should not get the vaccine, or is it really, if you're concerned, talk to your doctor?
I would say if you're super concerned, talk to your doctor. More often than not, you probably would qualify for the vaccine, short of people who got vaccinated and haven't had an allergic reaction, or people who don't qualify because of age. I would say in general, most folks should be, would be indicated to get the vaccine.
Got it. So just this statistic really quickly. Let me see where I am. So between January 1st and June 15th, 98.4% of hospitalizations and 98.8% of deaths from COVID-19 were in those who were not fully vaccinated. So that's, motivation if anything is. Cool. Okay. Let's see. What else do we have over here? I'm not sure if you touched on this. I know I've been hearing a lot about this. How long will the vaccine be effective, and will I need a booster? I think that they might be doing something in Israel related to the boosters for the single dose. Can you speak a little bit about that?
Yeah. So in vaccine land, we know that some vaccines require boosters. We're getting a better understanding of what boosters look like for the COVID-19 vaccines. So a lot of the safety studies are showing that up to maybe 12 months, maybe even longer, the protection that we get from being fully vaccinated can last. We have yet to see what that looks like. But when we think about boosters, there's a couple reasons why we need boosters. One, the safety and protection that we get, it can start to go down over time. But number two, sometimes you need a booster because there is a variant. And so variants are a natural part of viruses. They're changing, they find ways to survive. That's why we find mutation and variants. Like we see it in like bacteria, for example. We see it in viruses. We see it in a lot of other things. And so just like with the flu vaccine, we get a booster each year because there's new variants of the flu. Flu mutates pretty quickly. So we've seen it before too, and that's why a lot of the testing is being done to make sure that the vaccines that were made, they were made in a time when the most vaccines were made in a time where the variants that we're seeing right now were not out there. These vaccines were being tested, about a year ago, and we weren't even thinking about, well, the public wasn't really thinking or talking about variants. We didn't see how these variants were acting. And so if a variant comes and it starts to break through, and it's like breaking through a lot, and the vaccines aren't protecting, that's another reason why we could need a variant. That said, I think it's really important that variants come a lot quicker when we don't actually control the virus. So one of the best ways to make a new variant is to not control the spread. So we look to see kind of what happened and where we got some of our most concerning variants. We think to back in the day, the alpha variant and the beta variant, which we kind of saw in like the UK, and then we think about the delta variant, which developed in India during a time where there was just uncontrolled spread, and we saw what damage it caused back there. We're seeing what it can do now, and we're seeing now the delta variant is the dominant variant in the United States, and in New York City, we're seeing that more and more people are getting the Delta variant. And so that's just concerning that, we want to control this virus so that we don't see new variants.
Thanks, Dr. Watkins. We have a question here. What is the city doing to enforce mask mandates on the subway? So while the city doesn't control New York City Transit and the MTA, I think it's an interesting point. Some of the guidance has been relaxed in certain public communal spaces. So how is mask wearing being enforced? What are the current standards that people should be aware of?
Folks should be wearing the masks in subways and in public transportation. The mayor came out to say folks also should be wearing masks in schools. I would say, unfortunately, it gets really tricky when we talk about enforcing things. We kind of see how some things kind of play out. Last summer, when they were trying to enforce masks, mask mandates in certain parts of the city, it was kind of disproportionately affecting certain communities. So that's the hard part. I think for us, as individuals and New Yorkers, the best thing that we can do for ourselves is if we're on trains, using our own face covering, because it's a two-way street. Wearing the face covering or the mask prevents us from spreading it if we have it, but it also helps protect us by blocking it if someone else. So if you're in the train, or if you're inside or anywhere, and someone doesn't have their mask on and you don't know their status, wearing that mask also protects you. So I think that's the best thing that we can do, because it can get tricky nowadays as we're in this new phase where folks aren't wearing as much masks, aren't masking as much as they used to in New York City.
Got it. Thanks. it's hard to imagine, not wearing a mask in the subway at this point, but I guess we'll see how that evolves. In terms of mandates, people have been asking about, whether it's going to be mandatory for public school students once they're all eligible, or, for me at my public sector job, or maybe someone in the private sector, how's that going to work with employers in different settings?
I think that's something that we're going to have to keep an eye on. I know some healthcare facilities have mandated vaccines. I think there's a precedent for mandating vaccines. Some places of work, places of business mandate flu vaccines. Some schools and universities mandate routine vaccines for students as well. So I think with the precedent, I think once we get a full authorization for the COVID-19 vaccines, I think that conversation may look different. So I think it's just something to keep an eye on. And then also just knowing that, we may be on the fence, but seeing how, number one, safe and effective these things are at, preventing illness, preventing hospitalization, and really at controlling this virus. I guess the other thing was like, remember last summer, we only had last summer after some of the strict lockdown, right? We couldn't go anywhere. We had to, we're basically stuck inside. It really affected us. And we're here where we are now. A lot of that has to do with the vaccines and how safe and effective they are at preventing this thing. So that's another thing to consider as well.
Thank you. Next question. Do I need an appointment to get vaccinated?
You do not. If you go to the city site, any of the city vaccine sites, you can just walk in. There's also a lot of vaccine sites that are accepting walk-ins. A lot of pharmacies. You can even set an appointment for someone to come to your house and vaccinate you. So those are all really encouraging. At the same time, you can make an appointment still if you want one. You want to know that I definitely will have one there, and the lines won't be so long. So yeah, so you don't need an appointment to get vaccinated, but you can still get one if you want one.
And you bring up a good point. The in-home vaccination program is, breaking down every single possible barrier to getting vaccinated. And you can sign up at nyc.gov/home-vaccine, or you can call 877-VAX4-NYC. That's 877-829-4692. And, if you don't want someone coming to your house, but you do have some impaired mobility, you can get free transportation if you're 65 and older, or you have a disability. And you can also access that by calling the hotline at 877-VAX4-NYC. We have time for a couple more. Let's see. Could you speak to reports of people dying after taking the vaccine?
It's been rarely reported that it's happened. I haven't heard of any in New York City. I think a thing that is important to understand is that unfortunately people die a lot, and so they have to actually investigate what happened. We don't know. The whole point is was it the vaccine or was there something else going on? Because a lot of folks are living with chronic conditions. It's unfortunate. Some folks may have had a heart attack. Some folks may have had a stroke after. Some folks may have had some other thing brewing that the vaccine had didn't play any major part. The vaccine didn't have an effect. So that's why we want to really investigate. But I think the other part is, the vaccines, we're only considering vaccines, we're only talking about vaccines because of this other thing, this deadly virus that is killing New Yorkers, killed over 33,000 New Yorkers. Folks are living with chronic COVID symptoms. We don't know. We're learning about what that looks like, how long that lasts. So we're investigating what that could be, but overwhelmingly just knowing that so many folks are passing away from the virus itself. And also, there was a report that I think bears standing. We also have another public health crisis, the opiate crisis out there. That's real. Over 90,000 folks in the country have died due to opiates. And that's, in New York City, fentanyl and all of those things are tainting a lot of recreational drugs. So that's another thing that really the work to be concerned about too. So just to acknowledge unfortunately, there's a lot of trauma out there, but we are investigating some of those very, very rare cases of people who passed away within some proximity of getting vaccinated.
Got it. That's helpful, a helpful explanation. Here's a question. Are vaccines effective in communities of color? Are some better than others? I think we know that they've been tested, but are there some that are proven more effective?
More often than not, like humans are very genetically similar, and the way that we, in like a lot of our, the things that would make us identify in certain ethnic groups or racial categories, that's very rare. So basically, a vaccine that works for a brown person, works for a black person, works for someone who identifies as Asian, someone who identifies as white. We haven't found any evidence that one is more effective in certain groups than others. But I think what we have found is that, unfortunately, due to a lot of social issues and a lot of other things, it looks like that the virus is affecting certain groups at higher rates due to a lot of these other social issues. And I think the vaccines, what they do is actually help protect us, regardless of your race and ethnicity. And I think what we do have to do is think about some of the other social things that we're working towards, leveling the playing field.
Thanks, Dr. Watkins. I think we only have a couple of minutes left. Do you have any final thoughts, or how can people learn more about the vaccine if they're interested?
There's a lot of really great resources available online. Like I really like the health department's COVID data page for folks who have questions about what's going on in your neighborhood. You can click on your zip code and kind of see how many people have been vaccinated compared to the rest of Brooklyn, the rest of the city. You can actually see what the cases are looking like. So that's really helpful, and I think that's really useful information. I think the CDC has a lot of really good information. There's a lot of other resources that are available online, like the Kaiser Family Foundation. They have a series in both English and Spanish called The Conversation, and they have healthcare providers and folks who are answering questions, talking about real issues that they've heard. So there's a lot of resources available online, but there's also a lot of not so good information online. So be really careful, and verify the sources of where you're getting your information. People are spreading misinformation. People are spreading fear for whatever reason, to try to prevent people from getting vaccinated. But I would say definitely check the sources out there. And if something doesn't sound right, something sounds fishy, really verify and confirm with a trusted healthcare provider, someone who has the credentials, someone who, if you have a healthcare provider, someone who you're seeing a lot, verify with at the source, at the health department, at the CDC. That's the way. That's how we can protect ourselves, and protect ourselves not only from misinformation, but we can ultimately protect ourselves better from this virus. Final words are basically, we've been through a lot. It's been a really hard year. I think New York City in particular, we were hit hard. We were the epicenter of the entire world for what happened, and we lost over 33,000 people. We've been through multiple waves of this thing. We've been through the winter of 2020. It was really tough and really long. And when we talk about vaccines, that's the way that we can prevent anything as severe and as long and as horrible from happening again when it comes to this virus. Like, vaccines are a major way that we can do that. So just really encourage folks to protect themselves now more than ever with these new variants out there. It's real, it's spreading from people who are in people who are not vaccinated, and folks who are not vaccinated are unfortunately the ones going to the hospital, and folks who are dying. So just really, considering how we can protect ourselves, do the research, ask the questions around the vaccine, but don't forget that we're only talking about the vaccine because this deadly virus is out there and it's getting more efficient. And I think the last part is, vaccines do offer that protection, but that peace of mind, being able to see my grandma, and not, for the first time in almost 2 years, without worrying that she would get sick and die, being able to see my parents, you know, being able to see like an aunt who has, you know, is living with underlying conditions, and knowing, having that peace of mind that I won't get them sick, that they are protected from getting sick. That was just something that the vaccine offered me. And I'm really grateful for that. And I, you know, just want other folks to be able to experience that after such a hard year. I think it's something really to consider, and know, you know, it's come out a bit quicker than we've seen in the past. And I know there's a lot of questions that folks have, but, you know, I just really want to share that message as well.
Thank you again so much, Dr. Watkins, and agree we need to be sensitive to misinformation. I think, you know, one of the best sources is, as you mentioned, the health department's website, and that's nyc.gov/COVID vaccine. And from there, you can look at all of the cool data and any kind of, you know, health information or questions you have. So thank you everyone for joining tonight. Encourage you to use all the resources we discussed. Thank you, Dr. Watkins. Thank you to all of our interpreters and staff, and we hope everyone has a good night.
Thank you.
Okay, good night.
Bye, everyone.
Okay, good night, everyone.